about how to talk about what the overall report highlights were. What were these big system level pieces that we were finding? They really addressed access and quality issues to behavioral health services, culture and consumer choice. So when we're talking about consumer choice, we're talking about a consumer of behavioral health services. So are their needs, requests, and preferences being honored and taken into consideration when we're talking about treatment plans or even access to providers? And then there's kind of a series of what I would call additional barriers and unanswered questions. And some of those are really cross-cutting issues when we're talking about military sexual trauma that can end up influencing multiple areas, like the access, like the quality, and like consumer choice. So stigma is another one. So some really big buckets that really need to be considered across the whole span of the delivery system when we're talking about behavioral health services. There is a slide in here that also has a graphic with report highlights. I'm going to skip through that one today just for the sake of time, but if you would like to dig into that one any deeper or talk about it, we have that slide available online, and I'm more than happy. I could spend the rest of this meeting hours beyond talking about this report, so I'm more than happy to touch base with anybody if they'd like to discuss that slide. Again, to remind everybody of process, what this work started with was direction from legislature. Then there was the commissioning and the development of the behavioral health report. The study was released earlier this summer. And then what happened is we decided, well, what are we going to do with that report? How are we going to prioritize these recommendations? And there's 19 recommendations. So that's a lot. And there are about 19 system level recommendations in there. So that's a lot of work to do. And we wanted to go across the state and talk to communities and say, what does this mean to you? We did get, I think one of our high Eastern Oregon numbers was 21 participants, and a lot of the Sheriff's Department came out in Ontario. So we're just really happy to have some really great participation out in Eastern Oregon as well. So when we went through the forums, the purpose of these forums, again, was to facilitate community meetings across the state, enabling state agencies to best prepare to prioritize, modify, and implement the recommendations, to fit Oregon's unique needs, as well as address potential implementation barriers perceived by communities. And I think one of the things that wasn't in our scope of work, but that we really heard loud and clear as we hosted and facilitated these meetings, is these forums were really giving community members an opportunity to talk to each other. So they were open to anybody who was interested in any kind of veteran, military, any issue, whether they were focused on behavioral health, but we really welcomed anybody to attend. And a lot of times we'd hear, like, well, you know, I saw you at PTA, or I saw you down at a community center, but we talked about our kids, or we talked about work. We didn't talk about the veterans work that's happening in our community. And we found a lot of times people were very interested in supporting veteran community and veteran community members. They weren't necessarily coordinating that work. So that was one of the real interesting things I found there. Additional insights. We heard loud and clear that workforce challenges, particularly staffing. We heard a little bit earlier about the Mission Act, so coordination of the rollout of the Mission Act, education of community providers, those were challenges. The administrative burden of billing referral process, particularly with the VHA system and VBA. And a lot of times those were just questions and lack of knowing who and where to connect with. It's not necessarily that there wasn't availability at the other end, it was just how do we get to that other end. Housing needs, we heard that over and over. One of the things we also heard were older veterans were particularly concerned about stigma and stigma reduction of younger veterans being able to receive services and navigate the transition home process. Again, the desire for peer-delivered services, we heard at nearly every meeting, as well as an increase for case management and care navigation, especially when retiring, being discharged, or returning home from a deployment. So what's next? Okay, think I've just another minute or two. So what's next is we're looking at developing the implementation strategies. The community forums started in August, earlier this year, and they wrapped up in October. I've been working with our consultants to go over and develop some summary documents that will help influence and guide how leadership really assesses the prioritization from the community members. We did 17 community forums, if I didn't mention the number before. And so we're looking at how those implementation strategies and the community voice will be reflected in our decision making. And so I put, if you have a handout, I did put December 2019 to March 2020. Again, I'm giving myself a timeline there because I really want this to keep moving. And if I tell you all that I'm going to start putting something together now, that'll definitely, I think, hold me to it. But I want you to know that we're not just waiting for the report. I think we all know there's some issues that we can address now, and we don't need a report, or I was able to look at the report, the initial findings, and say, gosh, what we're already doing or what we're already thinking about aligns with what we're hearing in these communities, so why wait? I'm not going to go into all the fine details of what I've listed on the What Are We Doing Now slide, but I do want to mention there's a significant emphasis on facilitating and continuing to fund the mental health first aid curriculum across the state. And that has a military-specific curriculum. It's not just the adult program work. We've had a lot of the VSOs have attended that. We've had really good feedback, and I'm continuing to receive requests for that to be delivered in different communities across the state. And again, what I'm mentioning here is a very OHA-centric view. There's a lot of other work that's going on out there, but this is what the work is that I've been working on, particularly on my my scope of work. So the other thing is a Veterans Behavioral Health Peer Support Specialist pilot program that was also launched last year. We have 3 pilot sites in Yamhill County, Jefferson County, and Deschutes County. I'm currently working on a military suicide prevention training, an RFP, and that will be focused on kind of a cultural competency suicide prevention training for civilian healthcare providers, and that will focus on prevention efforts, intervention efforts, postvention, and treatment as well. And then I think you've already heard it today. I know Gus really brought attention to the outreach and engagement efforts, I think, across the agencies. And that's one of the highlights of all of this work, is being able to connect with leadership and staff at ODVA, develop partnerships throughout Vision 20, and then also work with other folks at other state agencies like lottery programs who have been funding us for the 1921 biennium, and then also Oregon Housing and Community Services. So at the very end, I listed my contact information. Please feel free to reach out to me. I'm available. I'm happy to share materials with you. And if you see a